So, hi everyone. I'm so excited you're here for another Wellness Wednesday. We're going to be talking about diabetes this week. And first, I want to say thanks to Special Olympics Kentucky and Danielle for coming in, as well as the students we have that are going to lead the activity today. So, Alyssa, if you want to share your screen, then we can get started with our quick intro. All right, so does anybody want to volunteer to go first on this spinner wheel? Alyssa, you want to explain it a little bit first?
Yeah, I'll explain it. So as Olivia just said, this week we're going to be talking about diabetes. So I thought it would be fun that we got our heart rates up a little bit before we talked about it, and we did some exercises because we all know exercise is good for you and your health. I could start by spinning the wheel and then doing an activity. Basically, I spin it, it lands on one of the exercises, and then you can do it either standing or sitting, whatever you prefer. I'm going to be doing it sitting down. And then I'm going to call on someone, and then they could pick their exercise too. Like, I'll spin it, you can pick your exercise, do it, and then you call on someone else. I have 8 of them here. I was thinking we do about 5, and then we could get going with the activity.
Perfect. Danielle. What will it land on? Nobody knows.
Okay, reach for the sky. So for this one, put your arms up, reach for a couple seconds, keep going, wiggle, do whatever you want. All right.
It's good to stretch.
All right, so fill up. I'm going to spin, and then you show us the activity. Sitting down. You don't have to.
Oh my God, it might be hard.
Yeah. Balance on one foot.
Ooh.
Put your arms up for your balance, or put them up. Yeah.
Nice, guys.
All right, and then Philip, you call on someone who you want to show the next one.
Okay, who wants to do the next one? Luke, you want to lead us in what the next spinner says?
Let's do.
See what we get.
So I guess we'll have to spin.
Let's spin it and.
Oh gosh.
Stretch of your choice, Luke. What stretch do you want to choose
your
for us?
choice. Oh my gosh.
Oh God.
I would say jumping jacks.
Okay.
Or no, not jumping jacks. Well, or would that be
your
okay?
arms.
Or
Yeah, we can do a few jumping
I'll
jacks.
stretch my arms.
Move the chair.
yeah.
Woo!
Good job.
Perfect, Luke.
Yeah.
And then pick someone to go next.
Ooh, Luke, pick someone to go next.
Oh, let's see. Ben.
Ben.
Okay.
Let's see what it is, Ben.
Yay me.
Jog in place. All right, Ben, let's see it. Let's lead us. Nice. Everybody jogging.
Good job.
Perfect, Ben. Good job, everyone.
And then we'll do one more.
Okay, Ben, call on someone else.
I say Hayden.
Okay, Hayden, you're going to lead us in the last one. Let's see what it is.
Gotcha.
Oop,
Okay.
that's a
Walk 5 feet. Okay.
Okay.
Maybe walk to the
Walk in a
kitchen
circle.
counter and back.
Pump your arms. Good job, everybody.
Good job. So thank you, Alyssa, so much for leading us in our activity. And now Danielle is going to get us started with diabetes.
Thanks, Olivia. Good afternoon, everyone. It's nice to be here. I'm excited. My name is Danielle, and I am with the University of Kentucky, the Kentucky Inclusive Health Collaborative, so Morgan and Lindsay and Austin and all those normal folks that you see every week. I am on a team with them. And so I'm super excited to be able to talk about diabetes with you all, because if you don't know, November is actually Diabetes Awareness Month. So it's a month where we take time to talk about diabetes and educate people and learn a little bit about it. So the first thing I want to do is ask you all, you can shout it out, you can put it in the chat, like what do you know about diabetes? Have you ever
I know a
learned
lot about it because I'm type 1 diabetic.
That's right, Claire. That's right. Okay, Lindsay told me that you'd be on here. I'm a type 1 diabetic as well. So Claire and I can swap some war stories. That's awesome. Anybody else? Have you heard some words that come to mind when you hear diabetes?
Well, actually, Danielle, I'm Luke, but I have two people that have diabetes. Actually, my mom's one friend, her brother, not brother, but son has, I think, diabetes or something. And then my dad's other friend has, I guess, has something going on with him too. I think like that too. So, but nobody in my family doesn't have that though. So, but.
Thanks for sharing. And I see Ben. Put in
my
the chat. Go ahead, Philip.
Yeah, my aunt Mary Lou, she had diabetes, but she's not living. She passed on.
Yeah, so I think that's good to know that most of us know somebody or know somebody that knows somebody that has diabetes. So, but I would like to just go to the basics and talk about what is diabetes, because I think it's something that we hear, but maybe we fully don't understand what it means. So I'm going to share my screen. Okay, so what is diabetes? Essentially, diabetes is when you have too much sugar in your blood because there's an issue with a hormone that everybody makes called insulin. So I always like to give this example. So imagine that your bloodstream, so your artery, your vein, any blood vessel, is big, long hallway. And it has a bunch of locked doors on the side. So when you eat food and then it turns into sugar, all of that sugar builds up in your big, long hallway. And insulin is the key that opens those doors to let the sugar go into your cells and feed your cells. So when somebody has diabetes, they either don't make insulin, so they don't have the key to open that door, or they don't have enough insulin, so they don't have enough keys to open enough of those doors. So that sugar builds up in their blood, which can be really harmful to a lot of different areas of our body if it's not gotten under control. So some areas in particular is your eyes. If you have high blood sugar for a long period of time, it can harm the blood vessels that go to your eyeballs and can affect your vision. It can affect your heart and your brain over time because your heart and your brain have to work harder to stay healthy. It can harm your kidneys, which are really important to like clean our blood and flush it out. It filters everything. So if there's too much sugar in your blood, that can be hard for the kidneys to do their job. And then it can also harm our nerves in our hands and our feet. So it can, those little tiny nerves that are in our fingers and toes, it can harm those over time if we're not taking care of them. So let's talk about, can you all see that I switched my screen? Cool. Okay, so let's talk about the difference between type 1 and type 2 diabetes. And I also want to say, if y'all have any questions, just shout them out. I want this to be informal. I want y'all to learn. It's going to be fun. So let's talk a little bit about the difference. Can I zoom in here? Let's see. The difference between type 1 and type 2 diabetes. So, and I'll share some of my personal experiences. And Claire, if you're comfortable, feel free to share any of your personal experiences. But like I said, both type 1 and type 2 have something to do with insulin. And so in a person with type 1 diabetes, like myself, I don't know if I mentioned that, I have type 1 diabetes and Claire does, that our bodies don't make insulin. So something has happened to those cells in our pancreas that make insulin, and they no longer are there and they're no longer producing insulin. Whereas somebody with type 2 diabetes, their body still might make insulin, but it's probably not enough to meet their body's needs. And so 95% of people, about 95 to 99% of people with diabetes have type 2 diabetes. And then about 5 to 10% of people with diabetes have type 1.
Danielle, I actually have a question.
Sure.
Is type 2 diabetes the diabetes that you can like get throughout your life, that you can develop it, correct?
Yeah. So we'll talk about how
Yes.
it kind of
Type 1 you can't.
Okay.
Type 2 you can.
Yeah, so type 1 diabetes is not preventable. It just happens. It happens to most people in childhood, but for me, it happened at the age of 24. So it can happen anytime in your life, but usually it happens to people when they're younger, is when it starts to show up, and it will never go away. Somebody who has
I was
type 1,
13.
what'd you say?
I was 13 when I was
Yeah.
diagnosed.
So it's usually like children, teenage, and like young adulthood. But I have heard of people getting diagnosed with type 1 in their 40s, 50s, 60s. So, and it's just, once you have it for life. And you'll never make insulin again, and you have to inject insulin, which we'll talk about in a second. And then type 2 diabetes is one that we still don't necessarily know the cause of it, but we do know that a lot of times type 2 diabetes can be prevented with a healthy lifestyle. So being active, eating healthy, drinking water, all of those things that I'm sure you all have talked about on previous sessions about how to stay healthy, all of those are going to help prevent your risk of getting type 2 diabetes. And I'm seeing some people in the chat are saying, they know some people with type 2, which makes sense because that's a lot more common. And so when we look at treatment or management, they're going to be different for people with type 1 versus type 2. So like I said, people with type 1 are always going to have to give themselves insulin every single day for the rest of their life. And so I have some props here, a little show and tell. So this is a vial of insulin. So you can see it's a clear liquid. It looks, just like water if you didn't know any better, and it comes in a little vial. It can also come in a pen. So these pre-filled pens, so all of this is filled with insulin, and you can just attach a needle to it, and I won't show you actually, but you just
I've got one.
Do you?
I've got one.
Yeah. Nice. Yeah. So then you attach a little needle to it, and then you just decide however much insulin you need, and you inject yourself with it.
Like I turn it right there, there's the down.
That's really cool. Yeah.
I'm on a pump.
Yep.
Insulin pump.
Yep. So I'm just like Claire. So I have an insulin pump. And so this little
The
guy.
Omnipod one.
Got it. So Claire has one that doesn't have a tube like mine does. Hers is just on her body, and she has to change it periodically, just like I do. And then mine connects. You can see.
Changed it tonight when I also changed my Dexcom.
Yep. And then so an insulin pump is a great way for insulin to be administered automatically. So the pump does the work for you. So instead of having to use a little syringe to draw up insulin and then inject it into myself, or filling up a pen, the insulin pump does it for me and gives it to me, which is pretty
Is that up to preference, whichever one you prefer, or is like one?
Yeah, so it really just depends on a lot of different things. Price and like insurance coverage is probably the most important factor. But yeah, there's certain like requirements, like if you're testing more than 4 times a day for your blood sugar, and if you've had diabetes for like a longer period of time, that's usually when you can start to look at getting an insulin pump. So, but some people always want to do injections. They never want a pump, which is totally fine. It's all personal preference.
Okay, cool, thank you.
Yep. And so, so that's how.
For a pump over shots because it helps you get more independence.
Agreed. Yeah. So thinking about like how you, your pump can just give it to you automatically. With the pen or a syringe, you have to stop and take your time to draw out how much you need and inject it into yourself. So I agree. There's a lot more independence with a pump, but it's really personal preference for a lot of people. And as far as treatment for type 2 diabetes, some people with type 2 diabetes need to take insulin. However, a lot of them don't need insulin because they still make it. So with diet and exercise, they can also take a medication that will help their insulin work better. So they have what they need, but this medicine just kind of comes in and like supercharges it. So their insulin works better and works how it's supposed to. So is there any questions between type 1 and type 2 before we move on?
Danielle, I got a question.
Yeah, what's up?
how are people with high blood pressure like affected with diabetes?
That's a good question. So they're not directly related. However, a lot of, like we were saying, a lot of the health behaviors like exercising and eating healthy are going to go hand in hand with those risk factors of high blood pressure and high blood sugar. So it's one of those things, if you're not necessarily eating the healthiest, you're not getting the exercise you need, you increase your risk for both of those, high blood pressure and high blood glucose. So it's really, like I was saying, a lot of the ways that you can control other health conditions or keep yourself healthy apply to a bunch of different conditions. So that's what I would say is some of the healthy behaviors really go hand in hand for those two. And I see, Kevin, you're raising your hand. You can unmute yourself if you'd like.
All right. Hey, Danielle, how can you tell if someone is like a low or something?
Mm-hmm. Have high or low?
Yeah.
That's
how can you tell if someone is
or cold?
What was that, Claire?
They either feel sweaty or cold is what I was taught at diabetes camp.
Yeah, so there's a lot of different signs and symptoms for high and for low blood glucose. So Claire, that's right. So a lot of people will get shaky, they'll get sweaty,
irritable.
Yep, they can get irritable, they can get confused, and then if that progresses too far and they don't get sugar that they need, they can eventually pass out. And then bad things happen from there. So if you do know somebody that is diabetic, especially type 1, if you start to recognize those symptoms in them and they may be a little are confused and lightheaded and shaky, that would be a sign or a symptom, definitely. That's a good question. And I do want to, the most important thing that I want you all to take away from this are this red column here, which are the symptoms. And so if you take one thing away from this, I want you all to understand the symptoms of diabetes, because it's really, really, really important to identify these so that you can take the proper steps to take care of yourself. So extreme thirst is one of them. So I remember before I was diagnosed, I was like, I could have drank the whole ocean. Like I was so thirsty at every single point in time and it never went away. And then along with that, because you're drinking a lot more water, is you're having to go to the bathroom a lot. So I remember one of the nights, the night before I was diagnosed, I got up to pee 7 times that night. And I was like, this isn't normal. Thank God I'm going to the doctor the next day. So those are the 2 really telltale symptoms. Some people also get blurry vision. I got blurry vision. And that's different than like when you need glasses and your vision gets like blurry over time. Like I just woke up one day and couldn't read like street signs because they were so blurry. So it's that like very sudden onset of having blurry vision. Being very tired or weak, that's a big one. Slow healing wounds. So if you have a cut or something and it's taking weeks and weeks and weeks to heal. And then lastly, unexpected weight changes. So people with type 1 will lose weight very rapidly. I lost 30 pounds in the months leading up to my diagnosis, but people with type 2 may gain or lose weight. So any weight change that's not intentional, where you're not trying to lose weight, but you are, or you're not trying to gain weight, but you are, that might be cause for concern. So if you or someone you know has any of these, it's very important to contact your doctor, but it's also very important to know that some people with type 2 diabetes might not have any symptoms because it comes on very slowly over time. And so that's, I wanted to talk to you all also about how to prevent. So this power of prevention is really important for people who are, in the pre-diabetes phase and maybe progressing towards type 2 diabetes. And so again, your blood sugar levels are rising, you're maybe a little in an unhealthy level. There's lots of things that you can do to decrease your risk of getting type 2 diabetes and decrease your likelihood of progressing to get type 2 diabetes. And so some risk factors, so some things that maybe make a person more likely to get type 2 diabetes are things like being overweight, having a family history of diabetes, having high blood pressure, which is what we talked about, having high lipids, which are fats in your blood, having a blood vessel disease, having a history of gestational diabetes, and that is diabetes that a woman gets when she's pregnant. So if your mom or grandma had gestational diabetes, that's a risk factor. Polycystic ovarian syndrome, which is something that happens to women. Being 45 years or older, getting less than 30 minutes of physical activity a day, or being African American, Hispanic, Native American, Asian American, or Pacific Islander. So it's important to know your risk factors and think, I've never gotten a blood test before, but maybe I have 3 or 4 risk factors. So maybe at my next doctor's appointment, I'm going to ask for a test. And Philip, I see your hand.
I'm gonna let you know I have high blood pressure,
Yeah.
and I take some medicine for it.
Mm-hmm.
Yeah.
Yep. And so that's, that's I think a common thing. And again, like we were talking about with, I can't remember who asked the question, but with the blood pressure, it's all very similar. So if we think about ways that we can prevent this, we can talk about healthy eating. So thinking of that My Plate and filling half of your plate with fruits and veggies. And then limiting your salt and your fat and your sugar intake. A lot of people think that diabetes means sugar. It's really, while that obviously contributes to it, it's really about healthy foods in general. So it's not only just sugar, it's that fat and salt as well. And then an easy thing is, which I'm sure y'all have talked about on previous calls, is swapping out water for those sugary drinks like those sodas or Gatorades is a really great way. And then increasing physical activity. Physical activity doesn't have to be running. I hate running, so I don't run. I like walking. I like lifting weights. Some people like gardening. So those are, find something that you enjoy doing. And I know it's hard kind of being in quarantine still, but just get moving some way that you like and some way that you're able to. Claire, go ahead.
I was gonna say I had stopped drinking soft drinks, and it has helped me with my sugars. Only now and then I'll drink some that have sugar in them, but I had stopped doing the ones with the diet ones.
Yeah.
But the ones with the sugar is to help with my sugar.
Yeah, absolutely.
I also drink lots of water because I don't drink a lot of soft drinks either. I just drink lots of water.
Awesome. Yeah, that's great. That's a great way, is to cut out some easy way to cut out some sugar and some calories.
See, I cut the soft drinks and started drinking iced drinks and coffee and iced tea instead.
Baby steps, right? Baby steps to get it to it. So there's 2 more things that I know we're kind of running out of time, but I'm happy to stay after 3:30, a couple minutes. So 2 more things that I wanted to go over with you all. And one of these is some numbers that if you do go get your blood sugar tested, what the numbers mean. So you can see on the right-hand side here is going to be your glucose. So this is blood sugar that we've been talking about this whole time. And so the optimal blood sugar when you're fasted, meaning you haven't eaten for several hours, is going to be ideally around 100. But I think the traditional diagnosis is 126 and under. So that's going to be normal range, but as people are usually between 80 and 100. And then when we get into this pre-diabetic range, we're in the 130s, 150s when we haven't eaten in a few hours. And then anything above that is going to be diabetic. So, but the thing to remember is that glucose in your blood changes every single second. It goes up and down all throughout the day. So even if you test your blood sugar one time and it's a little bit high, that doesn't necessarily mean you have diabetes. So what we use, or what your doctor would use, is what's called an A1C test. And what this test does is it tells the doctor how much sugar has been in your blood over the course of the past 3 months. And so an acceptable amount is to be 5.6 and under is like an acceptable range for diagnosis. And then
my doctor wants me to be under 7. So right. I'm like under 7, which is good.
Yep. So when you're
when I was first diagnosed, I was over in the 800s.
Yeah, I bet. Yep. So once you're diagnosed with type 1, they want you to be under 7%. But for the general person who's just being diagnosed for the first time, they want you to be under around that 5.6. And then that 6 to 7 range is when you start to get pre-diabetic, and then you go up from there. So I was 9.9 when I was diagnosed, which is very high and very So these are what these numbers mean when you were to get a blood test or an NA1C test from your doctor. So the last thing that I want to do, and I am totally okay if anybody wants to leave at this point, is I want to show you all what it looks like to get a fingerprint test. Because
Yes, I would love to see
y'all
this.
know Morgan, and we were supposed to, before coronavirus happened, we were supposed to have a diabetes screening event at the Winter Games in Louisville. But of course that got canceled because of COVID and all that stuff. But before it got canceled, Morgan and I were working on this together, and I said, hey, Morgan, have you ever gotten your blood glucose or your blood sugar tested? And he said, no, to be honest, it kind of scares me a little bit. It's a needle and blood. And I was like, that's totally understandable. I think a lot of people feel that way. But then Morgan and I were able to go watch a screening event, and he got to see what it was like to get your finger pricked and drop of blood and all of that. And so after we left, he was like, I feel a lot better about that. Like it's, you know, being able to see it and see that it's not scary. So I want to show you all what that looks like. And so I would encourage you all, even if you're not showing any symptoms, at your next doctor's appointment, just say, hey, do you mind checking my blood sugar? Or do you mind checking my A1C? Just to get a sense of where you're at. So then maybe you can make some healthy lifestyle changes. So I am going to have just a tiny drop of blood. If that bothers anybody, that's totally fine. You don't have to look. But I am going to show you. Move my keyboard.
That's why I'm going to look down, because I can handle my own blood. I just can't handle other people.
Sure. No, I
If you can't watch that.
I totally get that. So we have.
And I have a Dexcom, so I don't have to prick myself that much anymore.
I don't mind it.
Okay, cool. Yeah, like I said, if it's uncomfortable, you can look away. But this guy is called a glucometer. This guy right here. So this is the brains. This is what reads my blood sugar. And then in here are test strips. So these are a one-time use. You get a clean one. You pop it into the top of the glucometer, which turns it on. And then we have a lancet. And so this has a tiny, tiny needle inside of it. See, it's so small, you can't even see it on camera. And this is what is going to give me the prick on my finger. So I'm going to click this. And then the first thing that you want to do is take an alcohol wipe and clean your finger. So I'm going to take this, and I always like to use my ring finger, but you can use any finger you want, but usually the middle two work the best. So I'm going to clean this off. And again, at the doctor, they would do this for you. You wouldn't be expected to do it. So now my finger's clean. And I'm going to get a little bit of blood flowing to it. So I'm just going to gently squeeze it, squeeze some blood up to the top, and drink some water, actually.
So I do.
Yep, so I'm getting some blood up there.
Danielle, how often do you have to do this?
So I don't do this as much anymore because, like Claire, I have a Dexcom on my arm here, which tells me my blood glucose like every minute of every day. But before I was diagnosed, I was doing this at least 4 times a day, before every meal and then usually before bed. Okay, so this is all nice and warm. So I'm just going to hold it to my fingertip. 1, 2, 3, click it.
And having to do it more than that, like up to 6 times.
Right. And then you can see just a tiny, tiny drop of blood there. And then I'm going to take the drop of blood and put it on the end of the test strip, and it sucks it up like a little vacuum. And then so I put the test strip in there, and then it takes 5 seconds to read, and then my number comes out. And I'm actually a little high because I just ate lunch before this. I'm at 200, but that's not very abnormal for me after I eat. And then so if I need to, this tells me, okay, my blood sugar is a little bit high. So then I'm going to go to my pump and give myself a little bit of extra insulin, but I'm not going to do that because I'm actually about to go exercise, which lowers your glucose. And so that's it. And so that tells me what it is right now. And then if I took it 5 minutes from now, it would probably be slightly different. It would probably be like 195 or 210. It always fluctuates a little bit, but as y'all can see, it's not a scary process, right? It's just a little finger prick. I understand it's uncomfortable for some people, but it really is to understand your glucose and to know where your numbers are is more than worth a tiny little finger prick. And they'll usually give you a little cotton swab or a Band-Aid to put on.
Have you ever had problems with trying to understand how to change your transmitter? We've had problems with that before where it hasn't been clear on how to change transmitter.
Yeah,
we've had to call them.
I can totally stay on afterwards if you want to chat more. Absolutely. But yeah, so that's, I mean, did I stop sharing? Yeah, I'm not sharing anymore.
Danielle, if you don't mind me saying, and I agree with Morgan Turner. Whenever I see the needles or whatever, it actually freaks me out. But whenever I see the blood, trust me, I was okay.
Well, see, when I see mine own, I'm fine, but other people's, I'll either get sick or like faint, and I can't even watch other people get sick. So, like when I've done softball and stuff, and there have been people getting overheated and stuff, I have to like walk away because I cannot watch it.
Yeah, and I think those are all very normal feelings, and like I think anybody who would be testing your blood sugar would like hopefully have that conversation with you. And you could say like, I'm a little scared of needles or I'm a little scared of blood. And you could look away and not watch if you wanted to, I'm sure.
I don't mind mine.
Your
it's
own,
just like other people's I can't watch. So like when my mom has to go for like a blood test, or I have to go for a blood test and we do it at the same time, I kind of just turn my head.
But I always look at it this way, like I was saying, is like, if I'm not scared of needles or blood, but if I were, and that day that I was getting diagnosed at the doctor's office, if I was like, I hate needles, I hate blood, do not test my blood sugar, and I really didn't want to, then a couple days later, could have been in the hospital because they weren't able to know my blood sugar because I didn't let them test it. So that's really like, I think a good mindset to keep is like, a couple, not even 12 seconds of a little bit of uncomfortableness is really worth the information and the potentially life-saving information that you get from this. So I know it's scary. I totally get it. It's uncomfortable. I mean, I'm not scared of needles, but I don't think anybody likes needles. So I totally get it. But I would just encourage you all. It's really empowering to know your numbers and know where you're at so that you can take care of yourself.
I thought it was cool. I didn't know that it was only like one little drop. Sometimes when I get a paper cut, I bleed more than that. So that's not really that bad at all.
Yes. It's a very small amount of blood, definitely. Did someone else?
When my doctor gave me a shot, I don't fear needles at all. Just feel like a bee sting. That's it.
Yeah, and I think like it's even less than if you have like gotten a shot at the doctor. It's really like sometimes in the Lancet has different like levels on it where you can make it like, so like I don't know if you can see that, but there's like numbers. So if I want to make the needle like go deeper because I'm dehydrated and I need a little bit more, or if I'm really hydrated and I just need a tiny little prick, it can do that. So it's really, you can control a lot of this, and you can be honest with your doctor or whoever's testing and be like, hey, I'm a little nervous, and you can ask like, can you talk me through what you're doing before you do it? Can you give me a countdown? Like all of those things you can ask for to feel as comfortable as you need to. Yes, Claire, what's up?
Did you have to stay in the hospital when you were first diagnosed?
I did not, luckily. So I was actually very lucky, and I've never met somebody else with type 1 who didn't have to go to the hospital. But it just so happened that I got into the doctor quick enough that they just sent me home that day. So
I ended up having to go into the hospital because I was with the pediatrician when I went and was diagnosed because I was over 800 and I had already been sick with the stomach, well, not the stomach bug, but the flu beforehand. And I had gone back from a trip and I was like, complaining of being tired and thirsty all the time. And I was already on a medication that I got off of, which really helped after that and everything. But that caused me to be diabetic. And so I had to go into the hospital for 2 nights. But when I went to the doctor's office and my mom knew something was wrong, the doctor, knowing our history traits with my mother and stuff, we went ahead and went to the hospital. She had me go to the hospital at that time. And so my mom I did not know what she was talking about, what was going on. I was just worried about getting back home and getting to my friend that was spending the night. And I was over in the 800s. And as you guys know from Special Olympics and playing sports with me, I love to talk. And so I was talking away and did not understand that I should have been in a coma. And I've been low as I was over 800 and then I've been low as 16 and have not passed out.
Yeah, it's pretty. And that's the thing I think is we hear about diabetes a lot, but it is very dangerous. So, it can be life-threatening if you're too low or too high of your blood sugar. So it's really important to take the proper steps to stay healthy. I know we're a little bit over time, but again, I can stay on if anybody has any other questions.
And that's also why I try to stay healthy at home and only get around a few family members that I know that are not like going out places because of me and being diabetic. And I have asthma, and my mom has asthma, and her being 63 and over.
And that's a good point too about like exercising is, you know, exercise just helps us stay healthy in general, but specifically for diabetes, how I was talking about that medication that like supercharges insulin, exercise does the same thing. So exercise helps insulin do its job better. It's what's called insulin sensitivity. So the more you exercise, the better insulin sensitivity you'll have and the better insulin's going to work. So even, you know, if you aren't a type 1 diabetic or maybe you're pre-diabetic or kind of in that cusp range, exercise really can help your body and your insulin do its job like it's
As my mom says, that more exercise you do to lower your blood sugar, the more it helps. Instead of taking insulin, the more likely you won't be gaining weight, because I have the pump on my stomach, and so it always causes weight gain from where I'm having to take corrections when I go up. And so from right now, it's only like 99, and my error is pointing straight on my Dexcom, but my mom says instead of taking a correction, exercise, so that way you're not having to. But today, since it's cold outside, I drank water, but I flavored it and stuff.
Yep, that's very important.
Well, thank you so much, Danielle, for coming to talk to all of us. Kevin messaged me that he wanted to say something really fast.
Sure.
Hey, let's thank the UK people for a great 6-week testing, and happy Thanksgiving to everyone next week.
Thank you. Yes.
Yes, happy Thanksgiving, and thank you guys for this awesome class. I'm hoping we can do more in December on Healthy Wednesdays, Wellness Wednesdays. So I'm hoping for some more classes like this.
For now, but there will definitely be more in the future, so look out for that. But I've had the best time with you guys these past few weeks, and I hope you've had a good time too. We can all stay in touch, hopefully. And yeah, thank you all for coming. Thank you, Special Olympics Kentucky, and thank you, Danielle.
You're welcome.
Thank you, Hano and Tris, for sending me the emails and stuff and keeping me update with all this stuff. I appreciate it.
Everybody have a good holiday. Thanks, everybody.
Thank you. Have a happy Thanksgiving. Be safe.
Yeah. Happy Thanksgiving, Hunter.
Stay safe and wash your hands and wear a face mask and social distancing.
That's right.
Yeah. I'm going to head to the library, but I'm going to wear my mask while I'm